everyone. This is Dr. Edgar Ballenas, talking to you from the Office of Dynamic Evolutions in Health and Beauty, located in Norwood, Massachusetts. Today, I'd like to relay to you something extremely important, very, very exciting. We are always trying to gain better knowledge and understanding of what's available, and what's available now is what I am trialing as we speak. We all are familiar with the cannabis plant, and we're familiar, or I'll familiarize you now with the two main ingredients of the cannabis plant. We all have heard of something called THC, tetrahydrocannabinol, and that's an element of the cannabis plant that people are familiar with the plant, but when you smoke it, or it gives you that nice high sort of feeling, kind of like a mellow type of feeling, and apparently also that's where they get the munchies from, when they do the pot smoking. And the other ingredient that's considered to be 100% medicinal and is referred to as CBD. And that's this product right here. The company refers to it as Pico IV, Pico IV. A little bit more about what CBD, which is cannabidiol, okay? That's what CBD stands for. And it's been discovered to have its own effect. And the reason we refer to it as a medicinal portion of the cannabis plant is because it addresses medical type issues. And in this particular case, this component, CBD, was developed by a lab, a company that took it and processed it into an intravenous or liquid format. And as I mentioned earlier, I am trialing it out. So like I always say to my clients, new patients, I don't advocate anything that I wouldn't try myself. So in the IV format, it comes in what's called a vial, all right? And this particular dose is considered to be a good starting dose. And what are we utilizing it for today? Well, in today's world of stress, and whether it's work-related or non-work-related, it does build up, and it can lead to anxiety, correct? And so not that I have a great deal of anxiety, but yeah, sure, work-related stress. Sometimes it affects my sleep pattern. And so this particular product, made into the intravenous format, will go through an IV catheter, and that's what you see right here. It's connected to this tubing, which is then connected to this bag of fluid, which has this vial of liquid in it. So the total amount that we're talking about is 66 milligrams of this CBD contained in this vial, which I believe is 10 mLs, correct, 10 mLs. So what is the purpose of this particular product? Like I mentioned, in this particular case, anxiety, improving sleep disturbance. I usually sleep rather well, and however, there are days, again, when it's stressed and it becomes cumulative, I would have a hard time falling asleep. And also, as far as getting a good steady number of hours of sleep, that can be interrupted. It can be, again, anxiety or stress related. So I want to give it a trial to see the effectiveness of it. And very common that individuals come to see us, and anxiety is a common complaint. Sleep disorder is definitely a huge complaint. The other thing that's being studied, and this is at a university level, that these things are being studied, the effects, the dosing, and a very important thing to add, why IV, why intravenous? I mean, people, there's edibles that you can take, there's the smoking of it, inhaling of it. So why IV? Well, apparently the reason being is that it bypasses our gastrointestinal system, and because of that, the CBD does not, 100% per this company, converts over to THC. Why is that important? Well, not so much, I think, because of the fact that THC, like I said earlier, you take it in certain levels, it'll give you that high feeling, that euphoria. And although not really a bad thing, may not be totally what is necessary in the treatment of the ailments that this, which is being looked at for pain management. It's being looked for anti-inflammatory effects. In other words, people who have, say, for instance, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, where there's people are bothered, by pain involving their joints, and it's diffuse. It could be in their entire body. So apparently this will help those conditions, help pain conditions, help in possibly, and I think more than likely, taking people off painkillers. And we all know some of the bad effects from being somewhat dependent or addicted, if you will, to painkillers. So if we can improve upon pain control, pain management, conditions that have anti-inflammatory states, and it's being looked even beyond that, is being looked at having the ability to treat an infectious state, infections that can be due to bacteria, viruses, parasitic. So the studies that are at this university levels, all of those things are being looked at. And so far, there's been most of the cases have been positive with regards to being able to take care, of these diseased conditions. So there's a lot more that's going to be looked at. I think for now, here at Dynamic Evolutions, to help individuals with excessive anxiety, to help individuals, with sleep disturbances. We do see a lot of individuals who have concurrent addictive behaviors that they're being treated for. Alcoholism being very common. And of course, I just mentioned opiates, painkillers being also common. This may, in fact, have a vital role, extremely important role in being able to break that addictive behavior cycle, be able to get that individual functioning, and reducing, the amount of relapses that commonly occurs in those conditions. So stay tuned. As far as how I'm feeling right now, since I'm, let's see, about a third of the way of the bag, and I'm feeling relaxed. I'm feeling good. I'm feeling like, I've got very little stress that seems to be bothering me. And this is at the end of a busy day. So usually I'm at the end of a busy day having some type of stress. So, but right now doesn't seem to be the case. So thank you, and like I said, stay tuned. Bye-bye.